Hello, my name is Yesenia and I'll be doing the IFC interferential electrical stimulation. So to start off with, first and foremost, just like any other video, I'm gonna go ahead and give my patient education, how to properly take care of their electrodes. Before I even try it on a patient, I will make sure to establish my P's and C's. So my P's and C's would be any pacemakers, malignancies, metal infusions, deep vein thrombosis, if it's a female and if she's currently pregnant. So after I ask for any P's and C's and I get cleared, I will go ahead and determine what we will be doing. So for the purpose of this video, I'm gonna go ahead and do it on myself first. And I'm gonna go ahead and start off with the gate control theory. So my settings. So let's say I was I have this completely off, right? So I'll go ahead and turn it on. Just gonna wait for it to turn on. Okay, we're gonna choose electrotherapy, interferential for IFC. We're gonna go ahead and edit. Sweep. The sweep, I wanna make sure I have the sweep on. This is what's gonna deliver the beat frequencies. If it's off, it's gonna be at a fixed beat frequency of 100, but I wanna make sure I turn it on. The reason why I'm turning it on is because it's gonna give us a low and a high beat. This is just what's gonna deliver the electrical currents. And the reason why I'm also not gonna put it on fixed is because I don't want my patient to get used to the electrical stimulation of the fixed beat frequencies. So we just want to avoid that. So the beat is at 80. Again, I'm gonna be doing my gate control theory. So this one, the low is gonna be at 80, the high is gonna be at 150. Vector scan, I'm gonna go ahead and turn that on. Manual, so my 40% is gonna be targeting more acute localized areas, and then 100% is gonna be more of a chronic wider area that we're targeting. So for that one, we're just gonna go ahead and do manual. And then for vector position, I'm just gonna keep it at 45. So this is more of a even electrical stimulation that it's sending. For example, if I were to put it higher, it would get a lot more narrow, targeting more of a concentrated area. So I'm just gonna go ahead and leave it at 45. And then carrier frequency, since we are gonna be doing the gate control, we're gonna go ahead and leave it at the 4,000 hertz. My 2,500, that would be for more of the opioid release. So we're keeping that at 4,000. We're not messing with that. Treatment time is gonna be 20 minutes. All right, so once I set that up for gate control, I'm gonna be doing it on my quad. Now, if I were doing this on a patient, I would also assess their skin, make sure it's clean, dry, and intact. I'm gonna just go ahead and wipe down my thigh with the damp towel, not a paper towel. Getting rid of any excessive oil. Now for the placement, I went ahead and already connected the wires. This is gonna be wire A, wire B. one thing that we want to focus on is making sure that these channels are crossed over, like so. Okay. So it's going to be the first channel. And then the next channel, I'm going to go ahead and put it across like so. So we're going to have the two currents that are intersecting. It's going to be creating an interferential field. It's going to be invisible, obviously. It's going to go like this. Okay, so now once I have that connected, treatment time's already set. Yeah, so we're just gonna leave it there. Alrighty, so we're just gonna go ahead and up the intensity, and I should be feeling a tingly sensation. Okay. This is gonna be a stationary treatment, so for this one we don't have our patient move or anything. Oh, and then I completely forgot to start it. My bad. So now that it's starting, now I could go ahead and increase the intensity. And I'm just increasing until I feel that tingly sensation. And I'm getting a slight little muscle twitch as well. So again, you want to up the intensity to someone where it's comfortable for the patient. But since I'm doing it to myself, I'm gonna put it a little bit higher. See, we can see that slight little muscle twitch right there. So this would be more for gait control. Okay. Now if I were to switch it over to the opioid release, I'm gonna go ahead and pause it. And I'm just gonna go ahead and change my settings. So the sweep, like I said, I'm gonna keep that on. Excuse me. My beat low, I'm gonna go ahead and set that to 2. I'm gonna set that to 10. So usually it's anywhere from 1 to 25. Well, we could actually set it from 1 to 25, but what's commonly used is 2 to 10. For your beat low, beat high, and then vector scan, I'm gonna go ahead and leave it the same. carrier frequency for opioid release is going to be 2,500. So I'm going to go ahead and change that. I'm not going to touch that. Treatment time still the same. So this would be if I am setting it for opioid release. I'm going to go ahead and start the treatment. So again, I'm starting at a low intensity and then slowly turning it up. And then with this one, I could feel the pulses, the beats a lot more compared to the other one. The other one was more like of a vibrational sensation since it was a lot higher compared to this one. I'm just gonna up it up a little bit. And we have some muscle twitching. And with the opioid release, it's just gonna help us get that pain relief after the treatment. So you get like a two in one. If we're gonna, just depends on what we're gonna treat. If we're gonna use the gate control theory, that's gonna take the pain away immediately, and then the opioid release, this is what's gonna give us that pain reduction after the treatment time. So yeah, that basically concludes my IFC video. Thank you. Oh, and lastly too, before sending my patient off, if I was doing this on a real patient, I would also provide them with the little paper documentation of warnings, precautions, contraindications, just to kind of remind them once they use it, and also where to place it.